Welcome to the United Nations UN Logologo COVID-19 response. A United Nations flag flutters in Juba, South Sudan, during the celebration of the International Day of United Nations Peacekeepers. UN photo, J.C. McIlwain. Information for United Nations personnel around the world. The United Nations is monitoring the situation closely and working with all necessary partners to ensure the safety and health of everyone. And our duty stations are ready to take the necessary measures. This page contains important advice, guidelines, resources and materials on the corona pandemic for all United Nations work centers and offices, its workers and their families, visitors and healthcare workers in the United Nations. And the page is updated 24 hours a day, 7 days a week with the latest information. Coronavirus on the United Nations iSeek intranet. The coronavirus page on iSeek, login required, remains the central reference for staff of the General Secretariat for stories, broadcasts and announcements sent by the Department and Medical Services, and it is also a portal for pages created by the United Nations entities in Bangkok, Geneva, Nairobi and Vienna, and for field missions containing specific local information. Coronaviruses are a large family of respiratory viruses, and some cause fewer diseases than others, such as the common cold, and other more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome, and some of these viruses are easily transmitted from person to person. Unlike other viruses, the Department of Healthcare, Safety and Occupational Health Administration urges the following main preventive measures against the corona pandemic. Take steps to prevent illness with respiratory pathogens. Avoid direct contact with people who suffer from acute respiratory infections such as fever, cough, and difficulty breathing. Do frequent hand washing, especially after direct contact with patients or their environments. Individuals experiencing symptoms of an acute respiratory infection should practice respiratory hygiene, cough etiquette including stay home if you are sick, keep your distance from others, cover your mouth and nose with a disposable tissue when coughing or sneezing, use the nearest waste container to dispose of the wipes after use. Sterilizing hands by washing hands with water and non-microbial soap, rubbing hands with alcohol, or hand washing disinfectants after contact with respiratory secretions and contaminated materials. Avoid direct and unprotected contact with live or dead farms or wild animals. When visiting crowded markets in areas currently experiencing cases of the emerging coronavirus, avoid direct and unprotected contact with live animals and surfaces in contact with animals. The consumption of raw or undercooked animal products should be avoided, and raw meat, milk or animal organs should be handled with care, to avoid cross-contamination with uncooked foods, in accordance with good food safety practices. Preliminary information indicates that the elderly and people with poor health conditions are at an increased risk of contracting serious illnesses from this virus. Do not forget to subscribe to the channel to receive all that is new.